Do I start? Okay. Good morning, everybody. How are you this morning? Welcome to MHANYS virtual conference this year. My name is Glenn Liebman. I'm the CEO of the Mental Health Association, commonly known as MHANYS. We're so pleased that you were able to come in and be here today. We have quite a lineup of experts, both national and state experts. You're going to hear from all facets, from different people, from different perspectives, about three issues of great importance to us. You're going to hear about workforce, which is a huge issue I think we all have. I think it's the number one issue to so many of us. You're going to hear about crisis services. And you're also going to hear about one of our signature works around mental health instruction in school. So we're very excited that you're here today. We have, as I said, quite the lineup. For those of you who don't know who we are, MHANYS is an organization, grassroots organization, has been around for many years. We have 26 affiliates in 52 counties. You'll hear from some of those affiliates today. And what brings us together, many of our members provide community-based services, but we're also very ingrained in the community. I think that when people think about MHANYS a lot and MHA, they think about our advocacy, our education, our training, and we try to be out there in the community in so many different facets for the public mental health system, but also for the public period around mental health and education and et cetera. So we're very pleased that you're here with us today. I just want to say that unfortunately, due to a family event, the Lieutenant Governor will be unable to attend this morning. We were so looking forward to his presence. He's a very strong advocate in our area, and we were very looking forward to talking to him about many of our asks, including, which you'll hear prevalently throughout the day, our discussion around 5.4% COLA in the state budget, which will be a prevailing theme throughout the day. So that said, welcome, and I hope you get a lot out of today, and there'll be an opportunity to ask questions throughout the day. So please feel free to send those questions in. So I'm now going to hand it over to our board chair, Bill Gettman. Bill?
Thank you, Glenn. Good morning, everyone. I hope everyone's having a great week as we move into November in the fall. One piece of random trivia today. Today is the 135th anniversary of the Statue of Liberty. And so, well, that's just a random piece of information that you can talk about at dinner with your families today. I think what's most important is the ability to care for our entire state during a time of COVID rebound, mental health needs that are increasing. The history of this state and the resiliency of the state is just remarkable. And I'm happy to welcome you. And I'm so glad that Commissioner Sullivan is with us because she's been a steadfast leader and talk about resilience. At the same time, she's introduced innovation. So we have a lot of good things on the program today. And think about the Statue of Liberty and how New York has endured, and we will continue to endure through some challenges and come out stronger. So thank you, everyone, for participating. Thank you, Commissioner Sullivan. You're a rock star in our world. So back to you, Jackie and Glenn.
Thank you so much, Bill. It's greatly appreciated your remarks and your advocacy. Bill is a statewide leader in terms of the advocacy around workforce. We talk about it in the macro world, but Bill's living it every day as the CEO of Northern Rivers. He sees the workforce crisis on a daily basis, and he's been out there and he's articulated those concerns very strongly. So we'll continue to do that. So thank you, Bill, for all your advocacy on this. So I have the honor of introducing Commissioner Sullivan. I've done this. I was thinking about this last night when I was putting my remarks on. I've done this dozens of times. And I've said, lauded her wonderful work, and Bill said totally appropriately. She's spot on in terms of her knowledge of the issues, but she's also an innovator and a leader. And she, again, I could go on for pages and pages talking about her, but she's very modest too, on top of everything. But she's been commissioner, I believe, for 7 years now, and in her role, she's really taking on a lot of difficult issues and has really framed them in a sort of a really strong perspective about an understanding about mental health and about understanding the collective of how mental health is integrated into our healthcare system. And that is a huge piece, and it's a public policy piece, and she's really got it down. And she's really, you know, she's really understands the issues. She, from an advocate's perspective, she understands where we're coming from. She can't, you know, she doesn't have resources to respond to everything that we need, but she's always listening and she's always being innovative, and her team are doing a great job of responding to many of our concerns that we have on a daily basis. So without further ado, let me introduce Commissioner Ann Sullivan. Good morning.
Good morning. Thank you, Glenn, and thank you, Bill, for those really very kind words. And I just have to say back to both of you and to everybody in MHANYS, just the tremendous work that you have done over the, not just this year, but for so many years. You've been just so terrific. And on behalf of the governor and our lieutenant governor, I just can't thank you enough for everything that you've done. You know, every year I have a little bit of an opportunity to listen to some of the special projects that the mental health associations across the state do. And they're always incredibly innovative and incredibly creative, and done from the grassroots, from the needs of what we know that our families and our clients need. So I just can't thank you enough for the work you all do. This has been one very, very difficult past 20 months that we've all gone through this pandemic. And I don't think I could be prouder or happier about the response across New York State of the mental health system. Everyone has pitched in, everyone has been there. We've stayed open. We've been there during the worst times, and even as times are getting a little bit better, we're there. And I can't thank you enough. It's been tough. It's been tough. And we have a future that we're going to have to deal with, the long-term effects of this pandemic. And I think everyone's on board about that, and everyone's working to make that as successful as possible. So thank you, thank you, thank you. I just can't thank you all enough. And I know some of us have lost loved ones throughout this horrible time, and my thoughts are with you. But I do really thank you for everything you've done. So now I'd just like to talk about a little bit of what we've learned, I think, from the pandemic and where we want to go. And I'm going to have someone help me just make sure that I can get my slides up quick. Okay, here we go. Thank you, that worked. Thanks. So anyway, what I'd like to talk about, well, that's my big thank you first. And I was gonna put pretty graphics on with fireworks and stuff, it should be, but I'm sorry, it just came out a huge, big thank you, thank you. What I wanted to talk about were maybe 4 key areas, and very quickly, just to kind of give a scan of what we're working on post the pandemic. And one is prevention, because we know one thing, if we've learned anything from this pandemic, we've learned how important prevention is. Addressing the disparities in care, that's been so clear throughout this pandemic, that our Black and brown communities have not really received the brunt of this pandemic. And then some practice innovations, telehealth, comprehensive crisis services, and some of the work we're doing with intensive youth and also with rehab services. And then some ways of addressing the workforce challenges. Certainly not all the solutions, but some things that we're working on to hopefully be able to enhance our workforce going into the future. So first of all, just to talk about prevention. And, you know, everybody knows these numbers, but I think it's always worth just mentioning them again, that anywhere from 40 to 50% of New Yorkers will have a mental health impact from the pandemic. That's huge. And that means that we have to help have preventive services out there so that if we can prevent that impact from becoming a longstanding mental health issue, number one. But number two, that if someone does have a need treatment or need mental health intensive services, that we have those services there. So it's 2 pieces. It's that prevention piece, but it's also the service piece. The other number, which I think is really heartrending, is the United Hospital Fund study that was done in July of 2020. And the numbers are much larger now, but those are the firmest numbers we have, that 40.
Can someone get to the commissioner?
Commissioner, this is Jackie. You somehow muted. If you could unmute.
I'm unmuted now.
Yep, you're all set. Thank you.
Okay, okay, thanks. Oops. Let me see. I don't think I can move the slides though. I'm unmuted, but
You're unmuted.
okay. Oh dear. Okay, let me see. I think when I am, oh, well, let me keep talking. I'm gonna get someone to help me with the slides, but I'll keep talking.
Commissioner,
Yes?
you have help. You have help coming.
Oh, okay.
Jamie's coming.
Okay, thanks. So let me just say this, that in terms of those numbers about that 4,200 youth, there are probably about 6,000 youth now who have lost a parent or a primary caregiver. That's something we're going to have to work on going forward. That's a critical point to be able to make sure that those families and those youth have the services that they need. I can't seem to forward the slides. Okay, sorry, guys. Please forgive me for that. So what are we doing? What are we doing to deal with this? Well, one has been Project Hope, and I hope everyone knows about Project Hope, but Project Hope has given us the opportunity to have crisis counselors available across the hardest hit areas of New York State. And those crisis counselors are doing group counseling as well as individual counseling. And it's really very exciting, the work that they're doing, because we've been able to reach, if you look at the numbers, over 100, almost 150, over 160,000 New Yorkers with either individual or group counseling. That's been a tremendous preventive effort. And to some extent, we're going to have to continue this after this grant ends. This is a huge FEMA grant. The other thing we've learned from this grant is that when we first opened it, we had what we call the social emotional helpline, and there's still a lot of calls that come into our helpline, but almost the majority of those calls that came in were from the white population. So we were very concerned that we weren't reaching into the communities of our Black and Hispanic communities to make sure they got the same level of preventive services. So we did tremendous outreach on the ground with a whole bunch of community-based agencies, faith-based agencies, schools, et cetera. And that's where that 165,000 individuals that we've been able to work with has come from. And then we have great ability now. We've reached 44% of those numbers, that 165, are Black individuals that we've worked with in terms of the response to being able to help them through the pandemic. So I think what we've also learned is that how you approach our communities of color makes a huge difference. And that on the ground work, people have known this for years, but it's very important when you set up a prevention system that you make sure you're doing it right. So we've learned a lot from Project Hope. Project Hope will continue through a good part of next year. And then we're going to try to continue those preventive efforts past that to be able to ensure that we can work with families and with youth across New York State. So Project Hope has so far been very successful. We're doing a lot of other prevention, and I just want to mention this, a lot in primary care and in schools, and we've upped the ante in all those prevention efforts to make sure that we're reaching more individuals, especially in schools as families are coming back and dealing with the post-trauma of the pandemic. And when I talk about prevention and primary prevention, I always have to mention the School Mental Health Act that MHANYS worked so hard to get, because I think when you're talking about primary prevention, really helping individuals to make a difference before there's any mental illness, there's nothing like mental health education in schools. So again, that entire initiative from MHANYS has made a huge difference across the state. But just to go through a few things that we're working on in primary care offices, we have something called Healthy Steps, which is a healthcare worker, a behavioral health worker in the pediatrician's office. This is an evidence-based program from pediatrics. We only have it in 14 funded grants from the state across the state, but other pediatricians' offices have picked it up. Montefiore is doing a lot of work in this area, and we would love to be able to move this into a more general experience throughout primary care and pediatrics, and we're working with that. But the issue here is to get individuals that work with families and with kids early. Work with those signs early, the ACEs, the things we talk about having families and youth at risk. The important thing here is to be in that pediatrician's office working with them. And then Project Teach, which is fully funded by the state, provides consultation to pediatricians on an ongoing basis. Any pediatrician can call to get any kind of consultation, and that's been tremendously successful. And we've reached a large number of pediatricians over the years. The other major prevention efforts we're doing are in the schools. And here we have been doing much, much more this year than ever before. And we are working with the schools on curriculum to work with families, to work with parents, to work with youth, on the trauma-informed trainings. We've been doing a tremendous amount of work to help the schools be able to work with kids coming back and what that means. We've also greatly expanded our school-based mental health clinics. This is something we're very proud of. We had about 4 or 5 years ago, we had maybe 200. Now we have almost that. We have 910. And by the end of the year, we're hoping to have another 40 or 50 opening. We will work and partner with any school across the state. Our providers in the community have been tremendous on this. They partner with the schools, and we set up school-based satellites from the community-based providers. And once these are in the schools, they really provide tremendous services. And then, of course, all this work we do on suicide prevention. And just to remind everyone that we are very concerned and worried about the suicide post-pandemics like this, and post when there's economic upheaval. Often there's an increase in suicides. So far, we have not had that, which is great. But we still have, sadly, individuals who lose their life by suicide. But so far, the rate has not gone up in New York. But what has increased is youth coming into emergency rooms with suicidal ideation or suicide attempts. And so we know that this is growing, and we know that there is a crisis in this across the nation, but also in New York. So we are doing work with our emergency rooms, work with our intensive children's services. And I'm going to talk a little bit later about how we are expanding those services to enable to reach our families and youth, because it's critical during this period that we have those services available. And then On Track New York, with the money that has come from the federal government through a variety of sources, about $12 million will enable us to expand On Track. On Track is the first episode psychosis program. And with that expansion of dollars, I'm hopeful that we will reach 85, almost maybe 90% of New York, where we will have available within communities On Track services. That enables us, for individuals who have first episode psychosis, to get the help they need to remain in school or to remain at a job, to continue to get the kinds of support they need, in addition to medication treatment if it's necessary, or whatever other services are needed, but to enable them to continue to remain active and vibrant in the community, and hopefully be able to bend that curve of a long-term disability. These on-track teams have been tremendously successful, and basically almost 75% of individuals in this service have remained in school or employed, and that's terrific. So now just a few words about the disparities, and I just put up the slide just for people to see that the disproportionate impact that both mortality, morbidity has had on our Hispanic and Black communities due to the pandemic. This is one of my favorite slides, because if you were to overlay these neighborhoods, you will see that mental health issues overlay with all the social determinants of health and all the ACEs issues. And so basically, what someone said when they look at this slide is that your zip code is probably more important in determining your mental health needs as you go on in life than your genetic code. And so this is why it's so important to address the disparities that are a piece of all this, and also to look at social determinants, which is something we're going to be doing increasingly. I think all of healthcare has to do that, and mental health care has to as well. So addressing disparities, we've put into, for example, our RFPs that work that has to, the requesting party has to show that it's going to be dealing with whatever disparities might be in the area that they're working with, or with the population they're working with. We're going to be starting an OMH dashboard that will look at data. We have lots of data, but in the past we've not broken down that data by racial and ethnic categories, and that's what we need to do. The only way you can, I believe, really truly affect the disparities in our system of care is to know where they are and what they are. So we need to use the data to know that, and then we need to act. So we're going to be getting a dashboard for OMH, and when we get that refined enough, then we're going to be asking our providers to also use a similar dashboard to look at things like, for example, engagement and treatment. Is there a disparity in your clinic or my clinic in terms of engagement? Are we more likely to engage one ethnic group than another? Are we more likely to prescribe certain medications for one ethnic group or another? Are one group more likely to be hospitalized than another? And if we see those disparities clearly in our own house, then we act on them. And then there's a whole host of other seminars and work that we will be doing on disparities. This has to be long-term work, and it has to be a commitment that goes on over time. And we're going to be asking the mental health community to work with us on these issues. Many people are already doing a lot of work, but I think if we can centralize it, look at it, and get the data, we can know if we're progressing. We're also going to be, as part of this, having a new office of prevention and health initiatives at OMH, and we invite anyone to call us at any time for any needed assistance or any needed information or any help that we can offer, and that we'll be doing more and more publicizing of this over the next year. Now, access to care, and there are a couple of things that did highlight during the pandemic, and one has clearly been telehealth. I don't know that any of us actually ever expected this jumpstart that happened, but our services across the state adapted quickly and were able to provide tremendous services throughout the pandemic. You know, in February of 2020, before the pandemic hit, only 3% of work was being done by telehealth. By April, it was 90%. And now it's about 65 to 70%, and beginning to shift probably back to more of a balance of in-person and telework. But this has certainly changed the landscape. And if you talk with providers, the one thing you will hear is that individuals missing appointments have gone down significantly, that they've been able to have more appointments because individuals haven't missed those appointments. And most recently, I spoke with a clinic that was doing a hybrids groups, where basically some individuals came to in-person groups appropriately spaced, but if they couldn't make it that day, they could tune in via telehealth to the group. And so basically they were decreasing the number of times that individuals missed the group, but also it was easier then for individuals who might have trouble with transportation, et cetera, to get to the group. So those kinds of hybrid mixes, I think, are something we're going to be seeing, and we're going to learn a lot from this. And I think this has jump-started our use of technology. We did a couple of surveys, and they've shown that basically most consumers feel pretty comfortable with telehealth, and they found it easy and effective. And others, but there's a percentage, look at that last one, the 13% that don't, and we have to respect that. And we have to know that some individuals will definitely want in-person services, and for some services, it should be in person. So we're going to have to get to a balance over time, but I do think we're in a new world of using this technology. And then just to know that the major gains of the way we've been using it, at least in terms of Medicaid reimbursement, will continue post the pandemic. We've been done a lot of making sure that we don't lose this capacity. Medicare is still a little bit on the fence. They are still requiring for telephonic only treatment, some degree of in-person sessions as well over certain periods of time. There's a lot of lobbying to see if that can be changed, but the movement seems to be that, at least from the government payers, certainly from Medicaid in our state, and hopefully eventually from Medicare, that telephonic and telehealth will be reimbursed, including telephone only, for behavioral health, not for all of medicine, but for behavioral health. And I think that will be helpful for all of us. We also have to know, though, that some of our clients still have trouble accessing the technology for this, or the internet, et cetera. And so in-person services need to be there. And outreach in-home services, especially for kids, I believe need to be there. One very innovative example of using iPads. We've been working with several counties, with sheriff's offices, with them using iPads when the sheriff's office goes out and it sees a client. These are in the more rural areas where it would be hard maybe to have a social worker actually go out all the time. They bring an iPad and then they connect to a live mental health professional via the iPad, where they can actually talk to the client, talk to the police officer, et cetera, and have a consultation relative to the whatever the crisis is. And this has been working very well in areas where it would be very difficult to necessarily have a mental health professional go out all the time with the police. So basically, this is another option. It's not going to be the only one, but it's a creative use, a very creative use of technology, I think, that can have an impact on communities. And we're going to be expanding that with some of the dollars that we have. So expanding services, one of the big ones that we're looking at is crisis services. You're going to hear a lot about this, so I won't talk too much about it, except to say that 988 and the crisis system we're putting up, we hope will be a huge game changer. That this will essentially mean that when you call, whether you're calling because of a personal crisis in your family and you need some assistance, all the way to someone who's calling because a loved one might have an involvement with the police or be out on the edge of a very serious relapse, you can call this number 988 and you can get assistance. It's a tremendous ability to have one access point that people can remember and use. Now, if you have the access point, you got to have all the services that go with it, and then you've got to ultimately connect to treatment for people who need it. And that's what we're going to be talking about. So we're trying to build up at the same time, not just the 988 number, but mobile crisis services, ensure that our crisis residents get up, and that we start crisis stabilization centers across the state. And our goal is to have 10 of those crisis stabilization centers working by the end of next year. Hopefully that will happen. And we've got the regs moving, and we've got some startup funds in the mental health block grant. But also we will be working with making sure that the crisis residences, which we put up some dollars for before, get opened this year. So we're really working on not just a number, but on the crisis care continuum, and then ultimately on the other services that will be needed. This is going to be a big strain on a workforce which is already strained. But we do believe that the time is right. And certainly the startup dollars are there, and the 988 number, I think, can be a huge game changer for all of us. The other thing which is expanding, federal dollars have helped a lot with this, are the certified community behavioral health centers. We had the 13 originals several years ago. Now we have an additional 30 expansion sites across the state. The certified community behavioral health centers are particularly good because they are well integrated. You know, we often talked about integrated care between substance use and mental health. These guys really do it. So these are just some of the numbers. I won't go through them all, but there's some of the numbers that show that integrated care is really happening. The certified community behavioral health centers have also, for their population, been able to decrease emergency room visits and inpatient hospitalizations. So these centers have taken this comprehensive approach. They do outreach, they do some home visiting, they do crisis work, and they do integrated care. So they're a model for some of our clinics. We still have wonderful clinics who are not CCBHCs, but this is a model that we are going to be expanding as much as possible. And 24% of the individuals are currently in the CCBHCs had not received services before. So they are enabling us to expand capacity. And when we looked at Medicaid billing, just recently, we were up clinic visits across the state by about 10%. So while we're probably where we need to be able to expand capacity, we are expanding capacity. It is happening even under the strain of the tremendous strain everyone's having with the workforce. We will be expanding some children's intensive services. A major piece of that are Youth Act. We're going to have 14 teams across the state by the end of next year. And Youth Act will hopefully be able to be a community-based service that can help keep kids safe and at home, and get them as much as possible their services in the home. We're also expanding intensive outpatient, school-based clinics, and we are working with our residential treatment facilities as well as our community residences. There will be some additional financial assistance for them to do evidence more. They're already doing good care, but to do more evidence-based work. And we're going to be focusing on that, and focusing on that in the transition of these youth as soon as reasonable back into their families, and doing that basic family work. So all this redesign of the children's system is also happening. And basically we have closed some residential RTF beds, but we're also going to be keeping a large number of RTCF beds open. And we're working, and the RTF providers have been great in working with us on various models to be able to do really the best work for kids. And we are going to be giving some financial relief, which I think later on people can talk in more detail about. Also on the adult side, we're working again on community behavioral health centers, On Track New York, and a massive expansion, hopefully, of peer services. Out of the block grant, we're going to be doing a lot of peer services, CMS block grant for the FMAP investments, and also our core services have been established so that it will be easier to use peer services. And we will be moving the clinic to the rehab model. I think it's going to be sometime early next year. And that will enable, again, more outreach visits from the clinic, and also an easier access to peer services. So we think that those innovations will be helpful in terms of the design of the clinic system for adults and kids. Now, just to talk a bit for a few minutes about strengthening the workforce, $37 million is going to be going out to the workforce from a combination of the FMAP dollars and the mental health block grant. And these are one-shot dollars, so they're not things that can go directly to increasing salaries, but they will help with recruitment and retention with things like hiring and signing bonuses, longevity payments, shift differential payments, educational expenses, and career development and support. We are getting these dollars out. You'll be notified, if not tomorrow, by Monday. Everyone will know the amount they have based upon this formulas, based upon the federal ways we can give these dollars. But these dollars will be going out, and we are hopeful that this will help to sign on individuals, to recruit and retain, and get individuals interested in the mental health, in staying in mental health and not losing. I know that a major advocacy of the MHANYS and other advocacy groups are based on the payment to workers, their salaries, and that obviously across the nation, mental health has been an underfunded workforce. So we're looking forward to seeing what might happen, but these dollars are real. They're there now to support the workforce and hopefully to be able to engage people to stay. We've also been able to do some rate increases, which are more indirect ways for the individuals who run these programs, perhaps to give certain increases to their staff, depending upon how the money is used. But we are getting rate increases for ACT, for PROS, and for other community residences across the state. That gives us the ability to have more dollars to be spent on services, but also on the way you organize your services and salaries for individuals. Those will be permanent rate increases. We're going to fund those out of reinvestment, hopefully. So even though we're starting them up now with the federal dollars, they will continue. We also will be expanding peer services. We will be, we've also given, some of these dollars are to expand our BHCCs so that we can continue to work on value-based payments with the new federal waiver grant, so that dollars will continue to work with our behavioral health IPA groups and others that have come together to enable us to begin to continue to be a force in behavioral health payments. And then the DOH investments in children's services will also continue.
I'm not hearing anything here.
Hello? Okay, then the last is just to look at the career pipeline a bit. And the career, I think, the career pipeline is a way to probably work with schools in a more intensive way. So we are working, we're going to be expanding our schools social work deans consortium, basically to, that's a way that we work with the social work schools. It's really a small stipend, but we get social work students to come and learn evidence-based practices. We've been very successful in recruiting social workers into the mental health field. We're also looking at major collaborations with SUNY, CUNY, and with other educational institutions for recruitment, including high schools. And we're looking at a community mental health worker title. We're going to be talking with the community about this. These would not be licensed individuals, but they would be individuals who could do some engagement and support in the community, kind of like assistance to the licensed individuals. So licensed individuals can practice up to the highest level of their license. So those are some of the workforce initiatives. And then I would just like to end again with another great big thank you. I can't again thank everyone enough for just the tremendous dedication and caring that everyone has done throughout this pandemic. And thank you so much for all you've done. And it's been a real pleasure just to share this time with you and to talk a little bit about some of the initiatives we have going forward. So thank you. So Glenn.
Thank you so much, Commissioner. I really appreciate it very much. Again, you're a staunch advocate for our community, and it's greatly appreciated in all the work that's being done. And throughout the day, we're going to be talking a lot of, breaking down a lot of specifics around that. So thank you very much. Thank you for your support and your leadership. It's greatly appreciated. And we are going to talk about workforce, and I'm so excited about the $31 million that you were talking about, because we were, we fought and you listened about the need for the workforce specifically around retention and recruitment and bonuses. And we know it's one-time money, but we're so glad that it's going to be evenly split across providers across New York State. So thank you for that. Thank you for your leadership on that. We're going to morph right into our next program, which is supporting our valued assets, our workforce. And again, we apologize, but unfortunately, the Lieutenant Governor had a last minute situation and he had to cancel. So he's not able to participate today. but I know that he remains very interested in our issues, and we look forward to talking with him and having dialogue with him in the future.